I was talking about diagnostic in skin cancer, and particularly in melanoma, in special anatomic sites where lesions are really different from other general sites like trunk or limbs. So I was explaining the criteria for the early diagnosis of melanoma on the face and acral sites. Yeah, in these particular sites, dermatologists may have some challenges in the recognition of early melanoma. And for that reason, it's very essential to distinguish particular criteria that have been refined during the last years. And using dermoscopy, you achieve a better accuracy in that diagnosis. So we were explaining the audience how to recognize these lesions that sometimes are very subtle, according to the diagnostic features we use in our daily practice. These are what we call pseudo-network, and then blue-gray dots. We can see rhomboidal structures, atypical pigmentation of the follicular openings in these lesions particularly. This is very specific. And also the what we call a circle within the circle, that is again the invasion of hair follicles by the melanoma. Finally, we explained that when the melanoma progresses, then you have the destruction of all the anatomy in the skin. Particularly in a melanotic melanoma in these sites, it's sometimes very subtle to distinguish these criteria. So it's very essential that the doctors are looking properly at these lesions. Otherwise, they can be misdiagnosed and they can wrongly be treated with cryotherapy or some other procedures that are wrong at all. I was also in this lecture explaining the criteria in the another most eccentric site in the body, that is in acral sites. In particular, in volar skin, this means in palms and soles, acral melanoma is very different of some other sites because of the particular anatomic structure of the skin. It's very clear that acral melanoma is many times misdiagnosed by the doctors, and this is because this can be misdiagnosed as a common wart or just some other lesions are benign, and because of this we have thicker tumors, thicker melanomas in these sites. It's because of that that is very important to recognize the specific criteria for the diagnosis in acral lentiginous melanoma, where you can see what we call parallel ridge pattern, what we call diffuse irregular pigmentation, and sometimes, of course, with the progression of the tumor, you will see many other criteria. Unfortunately, many of these tumors are ulcerated, and they arrive to their final treatment very late. Having in the time where the first consultation was done at early stages, a long time with delay. For that reason, we have to stress the recognition of these early tumors. It's very important and very relevant to understand that in acral lentiginous melanoma, 10 to 20% of the tumors are amelanotic again, so they don't have pigmentation. In these situations, we have real challenges if we are not able to recognize the vascularization of the tumor. That is very, very important. Many times these tumors are treated like, again, warts, infections, disease, or some other particular situation, even like ulcers that are not healing during a long time. And this is really devastating the prognosis of the patient in the end. Yeah, I think that every clinician dealing with skin cancer, even if they are not experts in this topic, should understand and should recognize dermoscopic criteria in these particular sites. For that, we have several opportunities in educational meetings, also in workshops and courses. The many phases of melanoma are challenging for their daily practice, and even if in the hands of very expert dermatologists, sometimes they are very difficult to be recognized. Otherwise, today we have tools that can be used to do a very good job in early detection of melanoma, and this can have the opportunity to save many lives in the future.